with ADHD, just like just about all other forms of mental and neurodevelopmental disorder, medication can be extremely effective if you get the right medicine and the right dose. Medicines don't really last in their effects past the last dose on the last day you take it. Parent management, consultation in school, social skills training for adults, cognitive behavior therapy, CPT, learning time management and organizational skills, combination treatments, multimodal treatments are far more likely to put you back in the normal range of functioning and to persist than any single treatment. Autism is highly genetically vulnerable. Schizophrenia, also highly genetically vulnerable. ADHD has a similarly high genetic vulnerability, and it's not caused by parents being too lax and too lackadaisical. However, the causes of a condition, which might be biological in many instances with those examples, don't necessarily dictate what the treatment should be. We can treat schizophrenia with medications, but a supportive family is vital. Stimulant medications are a mainstay of treatment for ADHD, but structured behavioral programs in schools and in homes make a big difference, and they make the effects of the medications magnify. I like to say that we need to take the blame away from parents for most mental disorders, but not the responsibility. So, if my child's condition is largely biological, a parent might say, well, it's in their genes, it's in their DNA, I can't control that. That's not correct. Even for certain conditions, developmental conditions or medical conditions, where there's a very clear biological cause, family support and social support can make all the difference for outcome. They may not cure the disorder, but they help you adjust. Kids with ADHD don't try to be fidgety and squirmy. They don't try to be impulsive and inattentive. But with very consistent parenting and a very consistent school environment, with more rewards given than typical kids get, they can learn to manage their behavior better. The lack of school environment and the lack of parenting didn't cause the disorder, but they can contribute to treatment. Let's take away the blame, but not the responsibility. Authoritative parenting style is the goal of most behavioral parent management programs. Remember how much you do like that kid, even though it hasn't been very good for a couple of years now. But you're going to have to learn in a less emotional, less shouting way to help that kid manage her own behavior. So is there a correct way to parent every child? Probably not. But we know from much research over many cultures and many, many decades that when a parent has a lot of love and warmth for the child and also has a reasonable amount of structure, so loving and warm and controlling in the right ways and limit setting, authoritative is the term, that kids who grow up with authoritative parents tend to have good social outcomes and good academic outcomes. Of course, if you're a skeptic, you could say, well, maybe those authoritative parents passed along genes that make the kids cooperative too. You could only know if you did this in an adoptive sample. But we know from adoption studies, especially adoption studies of kids with ADHD, that, and of course in an adoptive family, there's no genetic relation between the kids and the parents. They share environment but not genes. Kids in adoptive families who develop ADHD trigger their parents to be harsh and controlling with them. And those control tactics by parents help the kid not to adjust well later, even in a family where the genes aren't shared between parents and kids. So parenting does matter just as much as biology matters. We don't have a cure, but we have ways of controlling it and managing it. Can we cure alcoholism? That's a big theoretical and ethical debate. Do you always have the propensity to drink too much? Perhaps, but you can manage it. It takes a ton of work. So the major forms of mental disorder, pretty much like cancer. Are you ever cured of cancer? You're in full remission, but you're probably in most cases more likely to get a recurrence than someone who's never had that cancer. So rather than cure, we talk about recovery, rehabilitation, and having the life you want to live despite some of those symptoms.